I'll never forget the first time I had to see a doctor after I got married. I was 19 years old, having female problems, and my mother in law took me to a clinic 30 minutes from our farm. We walked into that waiting room, and when they called my name, a male doctor came out to get me. I froze. I looked at my mother in law, panic all over my face, and she just nodded like it was fine. But it wasn't fine. I'd never been alone in a room with a man who wasn't family, and now I was supposed to let him examine me? That day changed everything I thought I understood about modesty, medicine, and what it really means to be an Amish woman navigating the outside world. I'm Sarah. I'm an ex-Amish woman from Lancaster County, Pennsylvania. I left the community 5 years ago, and today I want to talk about something that doesn't get discussed much but affects every Amish woman at some point in her life. Do Amish women go to female doctors? And more importantly, what happens when they can't? Here's the thing most people don't understand about Amish culture. Modesty isn't just about how we dress, it's woven into every single part of life. From the time we're little girls, we're taught that our bodies are private. You don't show skin, you don't talk about certain body parts, and you absolutely do not let men outside your immediate family see you undressed or touch you in any way that could be considered intimate. That's just the foundation of how we're raised. So, when it comes to medical care, especially the kind of care that involves examining private areas, the idea of a male doctor is genuinely distressing for most Amish women. In an ideal world, yes, Amish women would only see female doctors. That's the strong preference. But here's where reality gets complicated. Most Amish communities are in rural areas, small towns, farm country, and in those areas, there aren't always female doctors available, especially not specialists. The closest OBGYN might be 40 miles away. The local clinic might only have male doctors. And when you don't have a car, when you depend on hiring English drivers or taking a bus, and when you're paying cash because you don't have insurance, your options become very limited very fast. Let me tell you what happened in my community. There was a female doctor, Dr. Susan Miller, who practiced in a town about 25 minutes from us. She wasn't Amish, but she understood the culture. She knew we paid cash. She knew we needed appointments that worked around farm schedules. And most importantly, she was a woman. Every Amish woman I knew tried to see her for anything female related: pap smears, pregnancy issues, infections, everything. Her waiting room was filled with Amish women in caps and plain dresses. We'd wait for hours sometimes because she was so booked up, but we waited because the alternative was seeing a male doctor. Then Dr. Miller retired, just like that, and suddenly we had a crisis. The next closest female doctor was over an hour away. Most women in my community couldn't make that trip easily. So you know what happened? Women just stopped going to the doctor unless something was seriously wrong. They'd deal with painful periods. They'd ignore concerning symptoms. They'd skip their pap smears year after year. The barrier of having to see a male doctor was enough to keep them away entirely. I need to tell you about my own experience because it shows you how deep this goes. When I was 23, I had severe abdominal pain. It lasted for days. I thought maybe it was just my monthly cycle, but it kept getting worse. Finally, my husband took me to the emergency room because I was doubled over and couldn't stop throwing herself. The ER doctor that night was a man, middle-aged, kind face, very professional, but when he told me he needed to do a pelvic exam to check for ovarian cysts or appendicitis, I started crying. Not because of the pain, because a strange man was going to see me and touch me in ways that I'd been taught my whole life were shameful and wrong outside of marriage. The nurse saw how distressed I was. She asked if I wanted a female doctor, but they didn't have one available. It was late at night, so I had a choice: let this male doctor examine me or leave without knowing what was wrong and risk something serious. I let him do the exam, and the whole time I stared at the ceiling, tears running down my face, feeling like I was betraying everything I'd been taught about modesty and purity. Turns out I had a large ovarian cyst that had ruptured. I needed surgery. That male doctor probably saved my life, or at least saved my ovary, but even knowing that, I felt ashamed for weeks afterward. Now let me tell you how different communities handle this, because it varies a lot. Some of the more progressive Amish groups, like certain New Order communities, are more accepting of male doctors when necessary. They still prefer female doctors, but they understand that sometimes you need medical care, and you take what's available. The women in those communities are taught that medical necessity overrides modesty concerns. It's pragmatic. But in Old Order communities like mine was, and especially in Swartz-and-Truber communities, which are even more conservative, seeing a male doctor is really only acceptable in life or death emergencies. Even then, some women will refuse. I knew a woman who had a difficult labor at home. The midwife told her she needed to go to the hospital, that the baby was in distress. When they got there, the only OB available was male. She almost refused to let him help her, even though her baby's life was at risk. Her husband had to convince her. That's how strong the cultural prohibition is. Here's something else that's important. When Amish women do see male doctors, there are unofficial rules. The woman's mother or mother-in-law or another female relative always comes into the exam room with her. Always. You're never alone with a male doctor. That's partly for modesty, partly for propriety, and partly because having a witness protects everyone. The chaperone sits in the corner and looks away during the exam, but she's there. It makes the woman feel safer, and it protects the doctor from any accusations. Let me talk about pregnancy and childbirth specifically, because this is where the female doctor issue becomes most critical. Most Amish women use midwives, and almost all midwives are women, so that works out fine. But when there are complications, when a woman needs to see an OB/GYN or deliver in a hospital, the doctor is often male, and I've seen women delay necessary care because of that. There was a woman in my community, I'll call her Anna, who had bleeding during her 7th pregnancy. The midwife told her to see a doctor immediately, but the local OB was male, and Anna kept putting it off. She was embarrassed. She was scared. She convinced herself it wasn't that serious. By the time she finally went in, she had placenta previa and was at serious risk. The doctor had to do an emergency C-section at 34 weeks. Her baby spent weeks in the NICU, and afterward, Anna told me she wished she'd gone sooner, but the thought of a male doctor examining her had been too much to handle mentally. This is the reality. Amish women aren't being unreasonable or overly dramatic. This is genuine psychological distress, rooted in a lifetime of cultural conditioning. You can't just turn that off because you're in a medical setting. Now, here's what some healthcare providers have started doing to help. Some clinics in areas with large Amish populations make sure to have at least one female doctor or nurse practitioner on staff. They advertise this specifically to the Amish community. They offer evening and Saturday appointments because they know Amish women can't always get away during the day. They accept cash payments and offer sliding scale fees. And they train their staff to understand Amish modesty concerns. Things like always offering a female chaperone, providing full-body gowns instead of those skimpy paper ones, and being very careful with language and explanations. I've also seen some midwives in Amish communities partner with female doctors. The midwife handles routine care, but if something comes up that needs a doctor's attention, she refers the woman to a specific female physician she trusts. That relationship has saved lives because women are much more willing to follow through with a referral when they know they'll see a woman doctor. But here's the hard truth. In many rural areas, there just aren't enough female doctors, period, especially in obstetrics and gynecology. And Amish women suffer because of that shortage. They delay care. They avoid preventive screenings. They endure symptoms longer than they should. And sometimes that leads to serious consequences. Late-stage cancer diagnoses, untreated infections that cause infertility, pregnancy complications that could have been managed earlier. When I left the Amish, one of the first things I did was find a female primary care doctor and a female gynecologist. And you know what was amazing? I could ask questions I'd never felt comfortable asking before. I could talk about my body without shame. I could get pap smears and breast exams without the emotional trauma I'd experienced before. That freedom to access healthcare without psychological distress was something I'd never fully had as an Amish woman. But I also understand why my Amish friends and family feel the way they do. When you've been taught from birth that modesty is a virtue, that your body is sacred and private, that allowing a man to see or touch you inappropriately is sinful, you can't just intellectually override that when you walk into a doctor's office. The feelings are real. The distress is real. So to answer the question directly, do Amish women go to female doctors? They try to. They strongly prefer to. They will go out of their way, travel farther, wait longer, and pay more to see a female doctor if one is available. But when one isn't available, and when the medical need is serious enough, most will see a male doctor, though often with great reluctance and emotional difficulty. And some women, especially in the most conservative communities, will avoid male doctors entirely, even if it means not getting care at all. What frustrates me now, looking back from the outside, is how much unnecessary suffering this causes. Breast cancer that goes undetected because a woman won't see a male doctor for a mammogram. Cervical cancer that could have been caught early with a pap smear. Chronic pain endured for years because getting help means seeing a male specialist. These are real consequences of the collision between cultural values and practical healthcare access. I want to be clear about something. I'm not saying Amish women should just get over their modesty concerns. Those concerns are valid within their cultural and religious framework. What I am saying is that the healthcare system needs to do better at accommodating those concerns. Rural areas need more female doctors. Medical schools should incentivize women physicians to practice in underserved areas. Clinics should actively recruit female providers and advertise their availability to communities like the Amish who desperately need them. I also think there needs to be more education within Amish communities about the importance of preventive care and the difference between appropriate medical examination and impropriety. Some bishops and church leaders are starting to have these conversations, encouraging women not to delay necessary care even if it means seeing a male doctor. But it's slow. Change is always slow in Amish culture. Here's what I wish more people understood. When an Amish woman walks into a medical office, she's not being difficult or old fashioned by requesting a female doctor. She's navigating a genuine internal conflict between her need for healthcare and deeply held beliefs about modesty and propriety. She needs providers who respect that conflict and work with her, not against her. Since leaving, I've talked to other ex-Amish women about this, and we all have similar stories. The relief of being able to access healthcare without shame or fear, but also the understanding of why our mothers and sisters and friends who are still Amish struggle with this so much. It's not simple, it's not easy, and it's not going to change quickly. If you're watching this and you're in the medical field, especially if you practice in an area with Amish patients, please hear this. Having female providers available isn't just about preference. For Amish women, it's often the difference between getting care and not getting care at all. It can literally be life or death. And if you're Amish or from a similar community and you're struggling with this issue, I want you to know you're not alone. Your feelings are valid, and I hope you can find providers who understand and respect your needs. You deserve healthcare that doesn't come with emotional trauma attached to it. Thank you for watching. This is a complicated topic, and I know I've probably made some people uncomfortable. But these are the conversations we need to have. This is the reality for thousands of Amish women across this country, and their health matters.